Hi, my name is Lori Groh. I'm co-owner at Shoreside Therapies. Today we have again Julie Abdullah. And today, Julie, hi, how are you
Hey,
doing?
good. How are you?
Good. Today we're going to talk about OCD.
hmm
So I'm very excited to hear a little bit more about what you have to say. We're thinking actually we'll do two parts. So today we'll do part one, and then we'll continue on maybe in a week or so about the second portion. Today we're going to talk more about what OCD is and best treatments. In the second part, we'll talk about if you have a family member or a friend that is suffering from OCD and some good ways to help them cope through it.
Yeah,
All
I'm
right.
excited.
So Julie, let's start out with one of the first questions, which is how prevalent or pervasive is OCD in our society currently? So how common is it?
Yeah, it's actually a lot more common than people might think. About 1 in 40 adults and 1 in 100 children are diagnosed with it at any time. And half of those people that do have OCD have it pretty severely. It really can impact people's ability to work or go to school. And the longer that it is untreated, it can be more severe for people. And so it's really important to find a therapist and get treatment kind of early on as soon as you notice those kinds of symptoms.
So it sounds like it gets worse
hmm
as time goes on. It's not typically something that just disappears or goes away on its own, correct?
Correct. Yes.
Yeah. And so getting the treatment sooner than later is better and eliminates probably that potential for it to get worse and worse over time. Yeah.
Absolutely. Yeah. And there are, as we'll talk about in a minute, really great ways to just make sure that you're able to live with this disorder and keep it, under your control, and so it doesn't get to the point where it is severe for you.
That sounds good. Okay, so why don't you share with us what is OCD for anyone listening that isn't really familiar with that term?
Yeah, so OCD stands for obsessive compulsive disorder. So it has these two components. There's obsessions, which are really unwanted thoughts, urges, or images that a person is experiencing that can be really upsetting. The most common presentation I see with people is that the things we really care about and value end up becoming these things that we tend to worry and obsess over. And so by that I mean it could be someone's, maybe their religion or their safety, or germs for them if that's something that they really care about, their health. Those are the kinds of things that OCD can really take and become a source of anxiety for people. And then
Mhm.
there's the other portion, which is compulsions, or you'll hear me say rituals as well. So those are things that people are kind of doing, could be a behavior or a thought that helps reduce the anxiety that comes from having those obsessions. And so it's kind of this pattern between having the obsession, doing a ritual to kind of get rid of that anxiety, but then the obsessions are coming back, and it's kind of a zigzag or a seesaw
Mhm.
pattern that we see. Um, with people with OCD.
So, so Julie, basically what you're saying is that that these thoughts or images are kind of disturbing or distressing
hmm
to an individual, and they tend
hmm
to go around something specifically that they might be really interested in, or something that's a very important to them. And then
hmm
some of those thoughts keep coming up and coming up, and that brings on
Yeah.
that anxiety, and then the
hmm
behavior comes in as a way to alleviate that those distressing thoughts and feelings. Correct?
Absolutely. Yes.
Yeah.
And those behaviors really are a short term fix. So they might work for a little bit of time, bring down the anxiety. But we know that long term compulsions or rituals don't end up alleviating the anxiety that they experience from those obsessions.
Right. And it becomes that feedback loop, right? Where it's
hmm
working a little bit enough, it's working enough. And so
Yeah,
that relief then, reinforces it, right?
exactly.
Yeah. Yep.
Yeah,
And then long term, it's not really working. It starts to really interfere, correct?
correct. Yeah.
Yeah.
This is where, OCD can be really pervasive and severe for people. to be diagnosed with OCD, you have these obsessions and compulsions for about an hour a day, but most people have it for a lot longer than that, and it can get in the way of being able to focus at work or spend time with your family, kind of just be in the present moment.
Yeah, yeah. And sometimes it can also affect family members or people that are living with the person as well. And we can talk a little bit more about that next time, but that can also cause some relationship problems as well, correct?
Yes, absolutely. Yeah.
All right. So what is the difference between OCD and general anxiety disorder?
Yeah. So this is a common question because they are similar. They both involve anxiety, but there are some differences as well. So with OCD, we have the obsessions and the compulsions, and really it's that relationship between kind of those two things that keep it, like you said, in that feedback loop. Generalized anxiety disorder typically is worrying about things that are a little more real life, maybe things that are coming up, or uncertainties that you have about, your relationship or your job or things like that. With OCD, the obsessions can be a little more, can catch you off guard and might not be really realistic for you. And people with OCD are aware of that. And so that can be a big difference between the two, is kind of the types of worries that you're having.
Sure. And I do think, right, it's common for somebody that is suffering with OCD to recognize that some of those connections aren't necessarily making sense. It sounds like with general anxiety disorder, they sort of do make sense. Like, it does make sense to worry about some of those things,
Right.
about a job interview, for instance. But in that regards, that hasn't happened yet, and you don't know what's going to happen yet, and that uncertainty of it causes quite a bit of anxiety, whereas OCD type symptoms are more, if I'm getting this right, there's a concern about maybe contamination or germs, and then that anxiety creates that desire to do the behavior to get rid of that anxiety.
Absolutely.
Yeah.
Right. Yeah, there's not as much of the behavioral or response component with GAD or generalized anxiety disorder. So that is definitely a difference between the two.
Okay. So next question, Julie. So what's the best treatment for OCD?
Yeah. So the best, most evidence-based treatment for OCD is exposure and response prevention, ERP for short. So it's got two components. There's exposures, which are activities that you and your therapist would come up with to challenge those obsessions that you're experiencing. So someone that does struggle with anxiety around germs, an exposure might be using a public restroom, something that they would normally avoid. Maybe you have anxiety around kind of order and symmetry. Another exposure for that could be messing up your pantry a little bit and making sure, like, things aren't too even or too organized. And so kind of challenging those behaviors that you might engage in because of the anxiety you feel around those obsessions. And the response prevention part is making sure that you're reducing as much as possible that engagement in rituals or compulsions. So, I wouldn't want to have someone do an exposure of using a public restroom and then have them, wash their hands 10 times after. That would kind of get rid of the work that they did. And so response prevention means you're not engaging in those things that you can control, that are lowering your anxiety in the short term. And the overall kind of point of it really is to change your relationship with anxiety and just relearn, the way that we experience anxiety. It's not dangerous. It's not going to be around forever. And so just experiencing that does come down over time is really helpful for folks.
Yeah. And so quick question regarding that. So, part of that treatment, or the majority of the treatment, is kind of putting yourself in a situation that's going to cause some anxiety. Can you talk a little bit about, where they should start as far as when they're coming to work with you, because I do think that it's very possible somebody, that has OCD that's thinking about getting treatment might be really scared to come in and then, okay, am I going to just be, in a pantry, like my pantry, like I could send somebody in my pantry and it's definitely unorganized, but that somebody would be maybe scared to come in, that it might be too much. And so can you speak a little bit about that part?
Absolutely. Yeah. It's really important that exposures are a collaborative working piece between you and your therapist. So I typically like to have people use like a 1 to 10 scale for their anxiety when we talk about, what it would be like to do these different activities. If someone's at a 7, 8, 9, 10, the higher end of the scale, that's not where we start. It would be way more likely that they engage in rituals afterwards, and that wouldn't help kind of the learning process. So usually like a 3 or 4 or 5 is a sweet spot for, it's some anxiety so that it is challenging, but it's not too much to where they can't handle it, and it can be really scary.
Right. Makes so much sense, because if they're doing something that's at a 10, it's pretty likely that they'll go into the ritual behavior, correct? Yeah.
Mm-hmm.
All right. Well, thank you so much for talking with me today, Julie.
Thanks for having me.
Yeah. And so if you are looking to seek somebody out for OCD treatment, really highly recommend Julie, and you can get in touch with her through our site at shoresightherapies.com. And I'll put her contact information down below in the comments as well. So if you need to reach out to her, go ahead and do that. Really important to get that treatment, though. I mean, that's my biggest takeaway, is that the longer that you wait to get that treatment, the harder it's going to be, and the more suffering somebody's going to be experiencing.
Absolutely.
All right. Well, thanks again, and look forward to talking to you in part 2.
You too. Bye-bye.
All right. Take care.